My name's Jack Duffy. I'm 78 years old, and I had the misfortune, I guess, like many other 78-year-olds, of having to have a knee replaced, and I knew it was coming. Fortunately, I have a wise doctor, Dr. George Gay, who says, why don't you try the swing bed program, about which I knew nothing, at the Stoughton Hospital. It's pretty good, and the food there is better than most. I thought that was an incentive. I chose to do it in a rehab center because I need to be home to care for my wife, and I thought if I could get some care for the 2 weeks or so that I could go ahead and intensify the physical therapy to get the knee better. Now, I'm really happy that I did that, and I'm happy to attest to the pleasant surprise I had, first of all, the way the therapy was handled, because I was right there on the 3rd floor in this hospital, and the physical therapy little gym was right there. The therapists were available, and I would have physical therapy 2 or sometimes 3 times a day, and on the weekends, which really intensified the training program for me much more than it would have been if I had this care done at home. And I was amazed on the 3rd day. I thought, gee, these people are really sharp. This place is really nice. And my daughter is one she's an internist she was the chief experience officer at the Cleveland Clinic, and she now lectures around the world on how to improve the patient experience in healthcare. So I got on the phone and called her on the 3rd day. I says, Bridget, these people here at the Stoughton Hospital are already doing what you're trying to sell. I said, this is amazing how well they do it, how efficient the staff is, how professionally capable they are, how nice everybody is. And every time one of the nurses in the middle of the night, the custodian, the young lady who cleaned the room during the day, or one of the young kids who brought the meals up, when they left the room, they would always say, now, is there anything else I can get for you? And I thought, when they say that, these people really mean that. I immediately got the sense that all the people on the staff on the 3rd floor, the nurses and the CNAs who were involved in my care, they were most careful and interested in making sure my needs were met, but they also really cared for each other. They were really working as a fine oiled machine, a great team that really wanted to not only help the patients, but help each other. I was really impressed with that teamwork that they demonstrated. After I returned to my surgeon for a 3-month post-operative check, I suggested to him that you ought to recommend that Stoughton Hospital swing bed program as a rehabilitation station for any of your patients, because they'll really thank you for it. I knew I had to write a letter of appreciation to the CEO of the hospital so that he knew what a fine team he had delivering care to his patients. And I was feeling kind of guilty that I didn't get to the letter right away. And what compounded my guilt was I received in the mail a card from the nurses and the CNAs on the 3rd floor, where I spent several weeks of my life, each one of them signing and giving their name and best wishes and thanking me for letting them take care of me. And I thought, this is unheard of. They're thanking me for the care I receive for them. I thought, these people are really over the top. So I, Jack Duffy, am a grateful patient, and I really want to thank the team, the staff, and everybody involved at the Stoughton Hospital for the care I received.